urethra, it's a tube which carries urine from bladder to out of a patient. Urethral strictures can be caused by infections, trauma, catheter. Because of scarring, it narrows and you get some problems without peeing. And it can usually give extreme pain while peeing, can give infections and frequent peeing. The first treatment is do not harm. So there's some strictures which doesn't have any symptoms. You can just observe strictures and do nothing. But if patients have some severe symptoms, you have to treat them. There are some treatments which are quite good, but when you repeat treatment after treatment and again, the success rates are lowering. The standard treatment is to do incision of the stricture or dilatation of the stricture. Success rate is about 70%. Usually we have young patients which has got strictures without any cause, as we call idiopathic, and very easy patients. But about 20-30% we have complicated patients. And the stricture is very long if patients obese, have several illness and conditions like heart morbidity, lung morbidity, and previous radiation therapy. They have to undergo several procedures and several managements, and it's much more difficult to treat them. And with patients getting more nervous, their self-esteem can be lowered because of bad cosmetic results and because of voiding problems. If it's not going well, you have to undergo much more complex operations, which involves taking a graft, taking some tissue from your body. The most useful place from your body, it's buccal mucosa graft, or from the mouth, or lingual graft. It's a very big operation and gives morbidity to your mouth, and the operation takes 2-3 hours, and there are some complications. It's very important that they don't do any physical exercises because it worsens the procedure results. Usually patients, they have to go with the catheter for 1 or 2 weeks. When the catheter is removed, they can pee normally. After 2 weeks are gone, they have to be still cautious about their movements and exercises. And it goes almost 6 weeks before they can return to normal life. You need very good tissue quality to have good results. And these patients which have been treated for several times, tissue quality worsens and worsens from time to time. It's very good transplants. Mucosa from the mouth is very good, but the problem is you have not enough mucosa to repair a long urethral stricture. If you have a short urethral stricture, 3, 4, 5, 6 centimeters, it's okay. But if you have a long stricture, about 10, 15 centimeters, it's not enough of buccal or oral mucosa to treat it. We need much more research to know about tissue engineering and artificial grafts, and it will take a very long time before we know the end results of these tissues.